Patient comes to me and says, "Doctor, my partner did the herpes blood test. The result came back positive, but here is something many people don't know. About 1 out of 5 positive herpes blood tests may not be true infection. My partner has never had symptoms. No sores, no blisters, no pain. Now I'm worried. Should I get tested too? Do I need medication? Do I have to tell future partners? Is herpes dangerous?" And another question patients often ask is this: will this affect pregnancy? Can we still have healthy children? This situation happens very often. People do a herpes blood test as part of an STD testing panel. The result comes back positive, and suddenly everything feels confusing. One doctor says you should get tested right away. Another doctor says herpes blood tests are not recommended without symptoms. So patients are left with one simple question: what should I actually do if my partner's herpes blood test is positive? My name is Dr. Slava Fuzayloff. I'm board certified internal medicine physician working with STD Center NY. In this video, I will explain what these results really mean, when testing actually makes sense, and when doctors often recommend doing nothing. And in a minute, I will explain you when I test, when I wait, and when I recheck. Let's break this down step by step. First, we need to understand what a herpes blood test actually shows. A herpes blood test does not look for the virus itself. Instead, it looks for signs that your body has seen the virus before. Your immune system creates these signs after exposure. So the test is not asking, do you have herpes right now? The test is asking, has your body ever seen this virus before? But the test cannot tell when the exposure happened, who it came from, or whether the virus is active. This is why this matters for patient. A possible blood test does not automatically mean someone currently has herpes symptoms. Second, herpes blood tests are not perfectly accurate. False positive results do happen. That means the test says positive even when the person may not actually have the infection. Some studies suggest that about 1 out of 5 positive results may not be true infection. This is one of the reasons major medical guidelines do not recommend routine herpes blood testing for people without symptoms. Now let's answer the most important question. If your partner has positive herpes blood test, should I get tested too? In most cases, the answer is no. If you do not have symptoms, testing usually does not help. There are several reasons for this. First, the blood test itself is not perfectly reliable. Second, herpes is extremely common. A very large number of adults have been exposed to the virus, to the herpes virus, but most people never develop symptoms. Third, even if someone truly has herpes but has no symptoms, we usually do not start treatment. Medication is typically used when someone has outbreaks of frequent symptoms. So, if testing will not change treatment and the test itself is not perfectly reliable, Many doctors choose not to test people without symptoms. This is why herpes testing is usually done when symptoms appear. For example, a blister, a painful sore, or a new rash in the genital area. In that situation, we take a swab from the sore. This test looks directly for the virus and gives a much clearer answer. Now let's talk about how dangerous herpes actually is. For most healthy adults, herpes is not a dangerous disease. It can cause uncomfortable symptoms during outbreaks, but it usually does not cause serious long-term health problems. Many people with herpes live completely normal lives. They have relationships, they have families, and they have healthy children. The biggest problem herpes often creates is anxiety and misunderstanding, not medical danger. Now, let's talk about medication. Many patients ask if they should take antiviral medicine just in case. When I do not prescribe medication is when someone has no symptoms and no confirmed infection. Medication is usually used when outbreaks occur or when symptoms happen frequently. Now let's talk about future partners. Patients often ask if they need to tell other partners that they might have herpes. If you have never been diagnosed and you have no symptoms, you should not assume that you have herpes. A partner's blood test alone does not mean you are infected. Now let's talk about lowering risk. If a partner truly has genital herpes, there are ways to reduce the chance of passing the virus. Avoid sexual contact during outbreak. Use condoms. Sometimes the infected partner may take daily antiviral medicine to reduce the chance of transmission. These steps lower the risk, but they do not reduce the risk to zero. Now let's talk about pregnancy and children. This is another common concern. Can someone with herpes have normal pregnancy and healthy children? In most cases, the answer is yes. Herpes usually does not prevent people from having healthy children. Most women with herpes have normal pregnancies and normal deliveries. The main concern is when someone gets a new herpes infection late in pregnancy. The situation is uncommon, but doctors monitor it carefully. Sometimes medication is used near the end of pregnancy to lower the risk of during delivery. The most important message for patients is this: having herpes does not mean you cannot have healthy children. With proper care, pregnancy outcomes are usually normal. Now, here is the key point of this entire discussion. Herpes blood tests sound simple, but in people without symptoms, they often create more confusion than answers. A partner's positive blood test does not automatically mean you are infected, and it does not automatically mean you need testing or medication. When I test, it's usually because symptoms appear. When I wait, it's because testing will not change treatment. When I recheck, it's because new symptoms appear and we need clear answer. If you understand this framework, you do not need to panic when you see a herpes test result. If this explanation was helpful, subscribe to for more clear explanation about STD testing and sexual health and like us.